Hello or good afternoon, and welcome to another event in this year's German-American Conference. My name is Letizia Chiaredla, and together with Germany Martinez, I'm delighted to introduce you to our speakers for this COVID event. Together with Dr. Kathryn Stevenson, Dr. Klaus Reinhard, and Dr. Christian Bogdan, we will dive into the past, the present, and the future of the COVID pandemic. Markus Beck, Senior Manager at the GAVI Alliance, will lead you through a variety of topics. So now, sit back, enjoy the discussion, and please feel free to ask questions in the Q&A section at the bottom right. Thank you, and now over to you, Markus.
Thank you very much, Letizia, and welcome everyone to today's discussion around herd immunity. And I'm really pleased to be here today with you with such an amazing panel of three of our experts that I introduce in a second. Today's discussion touches upon herd immunity, and that is when most of the population is immune to an infectious disease, which provides indirect protection to those who are not immune to the disease. And in order to get this herd immunity, we need people to either get vaccinated or to recover after a COVID-19 infection. While in the initial month of the pandemic, herd immunity was often cited as the long-term destination or the holy grail to get really out of this acute pandemic. These views have shifted most recently, and there's a lot of discussion around whether herd immunity is still our objective, and if we're still on track, and how we really reach that objective. I would like to welcome our three panelists, and will introduce to you first, Dr. Kathryn Stevenson. Dr. Kathryn Stevenson is an assistant professor at Harvard Medical School and physician scientist in the Center for Virology and Vaccine Research and the Division of Infectious Diseases at Beth Israel at Deacon's Medical Center. Really pleased to have you here. Would you like to kick off with a view on the US before we move over to our German colleagues that I will introduce? And tell us what's the current status? Is the herd immunity still our objectives? Where are we, and what do we need to get there?
Sure. So first, let me just say thank you. This is a lot of fun for me. I rarely get the chance actually to talk so much with people from outside of the US, and it's really fascinating to hear these different perspectives. So I think people realize the US is a highly polarized country with very, very divergent views on vaccination across the US. The US is huge, about 350 million people with multiple different states that all have different approaches. So there's no one answer for the US, but I will say that there is a divide, I think, in the US between a feeling of what's the purpose of a vaccine. I think there are one group of people that really believe in the vaccines really for an individual benefit, where it's just about protecting yourself from progressing to severe illness. And then there's a whole nother group of people that believe in vaccines for their public health benefit. And I think that's where it gets to your question about herd immunity. So, and I think that's how our government approaches right now. Most of their recommendations really do encompass a very large public health approach, and often do focus on trying to build this concept of herd immunity. So when I think about this population-based immunity, I think about it as a wall, right? A wall against infection where people don't get infected at all. And I think that that is very distinct from the concept of an endemic disease or an endemic illness, in which there is ongoing replication of the illness, but where the most vulnerable populations are protected. But robust populations like kids or young people can just get sick and it's fine. So I think that there's very different approaches in the US towards the purpose. And I must say, I do think that people are giving up on the idea of herd immunity, because if you have half the country or more that doesn't even believe that that's a goal, then we're never going to get there. And I think that even our public health leaders are conceding this. I think you're muted. Yeah.
Thank you so much, Dr. Stevenson. Moving over to our German experts, I'm really pleased to introduce to you Dr. Klaus Reinhard. He's a practice-based specialist in general medicine, and he's the president of the German Medical Association. Dr. Reinhard, what's the sentiment and the situation in Germany? How would you compare that to the US?
Thank you very much for the invitation this afternoon in Germany and noon in the States, and I'm glad to talk to you. It's our actual aim or objective is still to reach a certain kind of herd immunity in Germany. We have reached the population over 60 years old, more than 80% of people vaccinated. So we could say that the population older than 60 years old is quite well covered to against the pandemic, against the virus. And we have certainly a percentage of population, it must be about 10, 15, 20% with a different view and with a reserved view on the vaccination. And we try to inform the people, we try to reach them with arguments to get the vaccination, because we see it's the only way to come out of the pandemic and all the measures we have to do against the pandemic. And I think we must, on the other hand, learn that it will be an endemic state further or later. I would say the next spring or summer we will reach this point and this moment, and we have to learn that it will be this virus will be between us in the next years, like it will be the flu, and in the same way. And we have to learn. We don't nothing about when have we to do the boostering, how often have we to vaccinate the people. A lot of questions are open, and we discuss about the questions. Actually, we see in Germany the increasing of the new numbers of infections, especially under the younger population, which is not vaccinated in the same percentage like the older than 60 years old. And but we see on the other hand that the relatively high number of infections doesn't provoke the same hospitalization we have had 6 or 8 months ago. So we must learn to see on these numbers without being in panic, without to react too quickly and too hard. And so I would say that at the moment our discussion is boostering. The discussion is when we have to do the revaccination after being immune after the first vaccination, or after the requirement, the natural immunity we have acquired after being affected by COVID. These are the points about we are discussing in Germany actually.
Thank you very much, Dr. Reinhardt, and that's a great transition to our third expert that we have invited today, Dr. Christian Bogdan. Really pleased to have you here, and you're right at the center of these kind of discussions. Dr. Bogdan is a professor of medical microbiology and infectious disease immunology at the Friedrich-Alexander-University, Erlangen-Nürnberg, and he's a director of the Institute of Clinical Microbiology, Immunology and Hygiene at the University Hospital in Erlangen. And he is a member of the Standing Committee of Vaccination in Germany, the STIKO. Dr. Bogdan, could you share with us a little bit more, elaborating on this current discussions that you experience on an almost daily basis, and how do you see the current German trajectory towards this herd immunity?
Yeah, thank you very much also for the invitation. It's really a great pleasure for me to participate in this German-American conference. Now, I guess with the term herd immunity, the problem already starts because it's a misnomer. It should be better called herd protection, because the persons who are not immunized, they are passively protective or indirectly protected by the fact that the others are immunized, but they don't have an own immunization received. Now, the other problem is, of course, if a pathogen such as SARS-CoV-2 can still be secreted or excreted in immunized people. You cannot really generate herd immunity in the strict sense or herd protection in the strict sense of the word. What you can reach is that the persons who are immunized, they will certainly release much less virus as compared to a non-immunized person, and they will also not develop normally symptoms. So you don't have all the clinical appearance of coughing and sneezing and so on, which then also contributes to a reduction of viral circulation. Now, in Germany, I have to say that our primary goal, also from the STIKO, from the Standing Vaccination Committee, has always been to, in fact, prevent severe cases of COVID-19. That was the primary goal, to prevent hospitalization, to prevent intensive care unit admission. The overall discussion in the public with respect to eradicating the virus, I think that was more or less then eliminated when it became clear that SARS-CoV-2, as also other coronaviruses, are not restricted to human mankind. So we cannot eradicate the virus anyway. And with respect to the numbers, of course, the idea has been as soon as many people are vaccinated, so let's say 80%, then we might have a very good chance to get the COVID-19 pandemic under control. So I would argue the primary goal still has to be to prevent severe disease. I think we can arrange with having harmless infections by SARS-CoV-2, and we can also probably get along with a certain amount of hospitalizations. But the key problem has to be that the overall circulation of the virus and the overall transmission has to be reduced. And in order to achieve that, we need, of course, a certain vaccination rate. And in Germany, we are certainly not yet at the forefront of what one could reach. But I would argue once you have something like 85% of people vaccinated, the chances are quite good that you will not run into a huge problem with severely ill people in terms of numbers. Of course, our goal should also be to prevent as many cases as possible. So the STIKO stands up or sticks to the original idea to prevent severe cases as the primary goal of vaccination.
Thank you very much. And I think that's very interesting when you see at the different curves, not only looking at the total amount of infections, but really the amount of death tolls, and I think there we also have different statistics when we look at countries like Germany, where the death toll has been comparatively low to other countries. Thanks to the health system in place and some of the other infrastructure in place. Dr. Stevenson, I would like to get back to the US, and you mentioned that it's being a very large country and being a federal country with different political areas in the countries. There's a lot of discrepancies, right? When it comes to vaccine coverage, when it comes to access, the mentality. Where do you see some of your struggles in the US in order to get this vaccine coverage higher? Or when you have some of the ongoing discussions now to get a better herd protection?
Well, I think you guys might be surprised or horrified to hear about how bad it is in some of our states, and particularly in different regions of different states. We have a lot of areas of the country where vaccine coverage is less than 40% of the population. Where we do relatively well is with people over 65, which I think is fascinating. So that's why I do feel like people are aware that there is a significant individual benefit for particularly vulnerable populations. And maybe that's because they've seen it with their own eyes. They've seen older people get sick. But for anyone really less than 65, the coverage can be pretty bad. So how do we approach that? And I think that or what is the cause of it? So it's really multifactorial. We have some of our political leaders, including some governors of our states, are not helping the situation. Some states like Texas or Florida. For example, in Texas, there's been a ban on mandating vaccination, even in their university settings. At universities, you're not allowed to ask whether someone is vaccinated or not by law. So there is an incredibly different attitude about vaccination at all, and it becomes a sort of medical freedom fight in many of these states. So that's one factor, but I don't actually think that's the primary factor across the country. I think there's also a tremendous lack of access to health insurance and medical care here in the US. Very large proportion of people do not see a physician on a regular basis at all, and do not have any access to really understanding the value of a vaccine except what they hear on Fox News. So I think that creates a lot of disinformation, and a lot of people that actually, if you just sat down and talked to them, would actually get vaccinated. So those are many of the factors that go into this. I think it's very hard from a national, federal perspective you can't impose these things on the states. They have a lot of independence, and that becomes a big challenge. And then the last thing that I would say is that we have a bit of a problem where in communication, where our Centers for Disease Control and our Northeastern academic states, we think we're all talking about boosters now. We're talking about how to improve our vaccines. And this is the conversation that gets out there. And then unfortunately, in the states that have like 30% coverage, all they hear is the vaccines don't work. And I think that is a major communications issue for us.
Thank you. That's interesting. This booster discussion, that it actually triggers some hesitancy groups in order to give up this discussion and say let's wait until we have more long-term data and how this will roll out. I think what I want to move over to Dr. Bogdan, because he's part of this discussion on booster strategies, and I wanted to hear a little bit his views on the booster discussion, and maybe keep him also in mind that we're still in a supply constrained scenario. There's not enough vaccines for everyone, and I think while we have this luck in high income countries to have this a steady supply and vaccine centers popping up literally all over the place in order to get vaccinated. And we have some other parts in the world where vaccine coverage rates are much lower. And Dr. Stevenson, you just mentioned there's some shocking states with only 40 or lower than 40% coverage. But indeed, we have some countries in the world where vaccine coverage are much lower. I work for an organization called GAVI Alliance, and we cater the poorest countries with vaccine supply. And if we look at some countries in Africa, we have a vaccine coverage in the single digits, or some areas really 1 or 2% coverage. So having that in mind, while discussing boosters and a third shot for people who are supposed to have already a solid protection, particularly the mRNA vaccines have to be in quite promising for new variants as well. I would like to hear from you, Dr. Bogdan. What are sort of the current discussions around the booster strategies?
I mean, one of the key factors or the key arguments, I should better say, for boosting is, of course, to prevent, as I mentioned beforehand, cases of hospitalization and severe disease. And we have observed, as also in other countries, that especially elderly people, but also the ones who did not respond primarily very well to the vaccination, are going to be affected by the infections right now. So from that point of view, the STIKO decided to have a recommendation for elderly people, starting actually only at the age of 70, based on the observations we have made so far with respect to the age distribution of breakthrough infections. And we also emphasized very clearly that immunosuppressed patients are the ones where you can expect reduced immune responses a priori. They should receive 3 vaccinations, and we actually separate in terms of the nomenclature between booster vaccination and optimization of a primary vaccination. Another important aspect, of course, is the situation in the hospitals. Here in Germany, there is an obligation by law that you have to prevent nosocomial infections, especially if they can be prevented by vaccination. So we are in a situation that we have to make sure that in the hospital, the doctors and the nurses are really vaccinated in order to fulfill that legal obligation. And from that point of view, the STIKO, of course, also recommended that all the personnel in hospitals, but also in elderly homes and in nursing homes need to be vaccinated. The booster discussion on the broad population level, that's really interesting because, of course, there have been now, political decision makers who actually went ahead in Germany and already propagated booster vaccination more or less for everybody. Yeah, and in fact, if you ask the vaccination centers, people can just walk in and get a booster vaccination independent of their particular health condition, age, or predisposing factors. So that's a kind of really weird situation. And of course, from an immunological point of view, you could also argue whenever you sort of push back the virus by having, highly maintained optimal immunity, even amongst the less susceptible persons, that can also contribute to the control of the virus in the population. On the other hand, I really have to remind everybody that even the best vaccines we currently have, they have a certain rate of primary vaccination failure. And what we currently observe and what people sometimes, just declare as breakthrough infections, they can also be primary vaccination failures in the range of perhaps 5% of those who have been originally vaccinated. So from that point of view, one has to be a little bit careful not to go ahead and propagate vaccinating everybody after 6 months after the second vaccination, just because of certain breakthrough infections, which might be due to primary vaccination failure. So finally, I would like to pick up your argument in terms of vaccination or vaccine availability throughout the world. Yes, of course, that's an important point. And there have been already discussions here in Europe to transfer vaccine doses to countries where the vaccination rates are very low. On the other hand, we all know about the logistic problems, especially with the mRNA vaccines. So it is not necessarily a solution now to sort of just shift vaccine doses if you cannot make sure that in the countries where this stuff is transported to, it is actually maintained under proper storing conditions until the people are vaccinated. So this is going to be, in my opinion, also an important issue to address. But I totally agree, and that's also the viewpoint of the WHO organization, to go ahead and make sure that we get primary vaccination or basic vaccination against COVID-19 all around the world, rather than starting boostering everybody in the countries I mentioned 6 months after the second vaccination. I would strongly adhere to that, unless we really run into a problem that vaccination and immunity, duration of immunity is much lower than expected.
Thank you very much, Dr. Bogdan. Dr. Reinhardt, as the president of the German Medical Association, I assume there's always this balance between the day-to-day challenges and the politicization of the whole discussion. And I think the association had a particularly a strong voice along the STIKO recommendation to mitigate the situations in hospitals and for doctors. How do you see the current situation and the lifting of some of the restrictions and the stagnating vaccine coverage in relation to these discussions around boosters, around children vaccinating below 6 years, as of 5 years, pardon. What's the current tensions that you're dealing with on a day-to-day basis?
Yeah, actually, we discuss if we could give away a lot of the restrictions we had to use in the last months. But I think it's too early to decide that at this moment. I think we should look how develops the situation in the next 3, 4, 5 months during the winter now. because we don't know exactly how many severe infections reach the hospitals and get hospitalized, and therefore I think we should be careful again and still a few months. But there's one argument which is, for me, is very important, is the issue of the breaking through infections. We have 55 million people vaccinated in Germany, and we have about 95,000 infections by breaking through infections after vaccination observed till now. And this is a very low rate. And from this 95,000 people infected, vaccinated before, we can observe that only a very, very low part of them get really ill and must be hospitalized. And therefore, it's important for the media to inform in the right way about these cases. There are a lot of people get the impression that it is not necessary to or that it's not useful to get vaccinated, because anyway you can get affected by the virus as well. And this is this misinformation which is created by the media information, or the way the media inform about these cases, because it's interesting. It's of high interest to report about a person who became ill vaccinated before. And I think there's a responsibility by the media to inform in the right way about that. And this is a point we discuss actually, and we have to look on. And the rest, I think we personally, I think we can be quite sure that we will get not so many hospitalizations this winter we have had last year because of the vaccination. And seeing that, I think we later on in February or March we can draw down the restrictions we had used in the last year.
Restrictions is a good word. Dr. Stevenson, in the US, I assume restrictions vary from state to state as well. Do you see that there's also a certain danger on opening up too quickly, and with now increased mobility, the US welcoming international travelers back into the countries, and given that there are other parts of the world with much lower coverage levels where the virus keeps circulating and potentially mutate, do you see that the way back to the new normal is too quick?
Well, honestly, in parts of the US, they never locked down at all. Yeah. I mean, there is a tremendous number of people that have never stayed home from work, have never worn a mask inside. You know, it's amazing. I was looking at some statistics among people who decline vaccination, you know, who've been offered it, they know about it, and they've declined it, and they asked them, what's your mask use? And 25% of them said they've never worn a mask indoors. So if you think about that, we've never had a situation really in the US where, you know, lockdowns were so severe that we're really talking about the opposite of opening things up. I mean, Massachusetts is very different. The state that I'm sitting in, we do have that. But I think, I guess what I would say is that I think sometimes we talk about vaccination as if it's the only topic and the only way to do prevention. And this is kind of what you're talking about in terms of non-pharmaceutical interventions. And I do think we need to always think about vaccination as part of a portfolio of prevention. And this is something we learn in HIV medicine. So I'm a physician, you know, for patients with HIV. And we know that everybody's different and not everybody takes the same precautions and they prefer different types of prevention. And I think to some extent we have to accept that there are people who will not get vaccinated. So we need to find other ways to appeal to them in other forms and other investments in how to prevent particularly transmission among those individuals. So I just throw that out there. For example, new antiviral therapies that people could potentially take upon getting diagnosed that can particularly prevent progression to disease and prevent transmission. So I think that there are ways to scale back some of our strict rules, particularly in a state like Massachusetts, but we do need to bring in the whole portfolio of other preventions beyond just lockdowns that may help us get to a kind of new normal.
Dr. Reinhardt, how would that be in Germany to build on our health system and to come up with other means in order to get to this 85% coverage? And if we don't get there, what kind of other means do we have? Are we still talking about keeping the masks for the next couple of years, the distancing and some of the other measures, so that we make sure that the people who do not want to get vaccinated are not at risk?
I think we should use the 2G we have: getested, geimpft, vaccinated, and or naturally immunized, or not tested. We have 3Gs: with test, vaccination, and natural immunization. Or 2G means vaccinated or naturally immunized. And to be immune is the one or the other way. The 2G we have to use in large areas of the public life, the social life, and so that it's become a bit uncomfortable for those who are not vaccinated now to move in a free and to a new normal way. And I think this could be a good could give a bit of drive to them who have till now didn't want to get vaccination. And then we have to look for treatments of the COVID, of severe COVID cases. We didn't talk about monoclonal antibodies, for example, or antiviral pharmaceutics, which are in development. And I think so with the one and the other, the increasing of vaccinations and with new treatment forms, I think we can be we go a big step ahead towards a new normal, and I would say that we can reach it in the next spring. I'm quite certain about that, and we have to, as I told you before, we have to learn that we will have still at any time a certain number of infections in among the population, among the society. We have to treat them, and we have to look for them we have to prevent that we became a number of hospitalizations and treatments in the critical care that this is an overboarding situation like we have had a month ago, but I don't think that will happen.
Thank you. Dr. Bogdan, the 2G, 3G is a big discussion in Germany, right? From an ethical point of view, how should we give privileges to vaccinated people? And I remember in the early days where vaccination was still limited and you had to queue, that was an absolute no-go because you didn't want to give a double privilege. But nowadays, being accessible to everyone, is that something that should be contemplated, or are we crossing a barrier that goes too far? We have some states that have already adopted for that strategy. What is your take on imposing such an indirect mandatory vaccination?
I mean, this is certainly a flourishing discussion currently also in the German society, because as you certainly have heard, the tests are no longer paid by the state from a certain deadline onwards, except for certain persons who are really not being able to be vaccinated or who cannot build up a own immune response to the vaccine. So yes, it's true that if you pursue that strategy of either being vaccinated or recovered from infection or tested than the ones who are not vaccinated. They are running a kind of financial burden. And this kind of financial burden can certainly, at least part of them, lead them to become vaccinated in the end. But I don't think, I would not argue that this is the primary political strategy, although some politicians have aired that kind of thinking. In my opinion, we still have a situation where some members of our society are not really anti-vaccinists, but they are a little bit doubtful. They have heard, sometimes even because of very strong scientific background about side effects. And some of them are sort of in between, yeah. And you need to talk to these people in order to convince them of the necessity and the rationale of being vaccinated. So at the moment, yes, we have in a certain situations the problem that people might spend a lot of money if they do not get vaccinated because of the testing obligations. And on the other hand, one also has to say the ones who are not vaccinated and the ones who have not really been infected in the past are the ones who are most in danger, and also they can get infected by the vaccinated ones. Yeah? So this is this kind of thinking we have to convey in order to make clear that vaccination is the only way to protect yourself. Vaccination is currently, it has two major purposes. The one purpose is to get the overall virus under control and the transmission and reduction of transmission, in addition to, of course, reduction of the numbers of people who are currently infected and sick and hospitalized. And on the other hand, the key goal is to get your own body protected. So this is something I think which has not yet been fully understood by certain parts of the society. And this we massively have to promote by really openly addressing the key issues. And one of the key issues is that we as scientists have to admit that we do not yet know everything about the virus, and we do not yet know everything about the vaccine. And if you openly address that, then in my opinion, the chances are really high that you can convince people. I think as long as you pretend that everything is perfect, everything is 100%, everything is without any side effects, then you are run into the problem that people will pick up messages on the media and strongly then argue against vaccination. If you are open about it and if you really address the points which otherwise will be picked up by the media and by anti-vaccinists, the chances of convincing people of the beneficial effects of vaccination are much higher. With respect to 3G in Germany, so vaccinated, recovered, or tested, because we have a lot of students listening. Here in Germany, tomorrow my main lecture is going to start, and I'm fully entitled to check the students for their vaccination status or for their status of being recovered or for presenting the test result. I'm not going to do that with everybody. I can tell you right away. We only have to do it on sporadic. It's a sporadic testing or a sporadic control, I should say. But this is the entrance key. If you are not fulfilling that, you cannot go to university. And I have to say that I strongly was fighting for that regulation because I wanted to have the students being back to university. And there's no reason not to have them back at university because we have a general obligation to wear a mask in the lecture halls. So there's no distancing anymore in the lecture halls, but full masking, and you have to be vaccinated or recovered or tested. And that's the way to go, in my opinion, because that's also the way how students will be back to university. So from that point of view, yes, we have to, I think, convince still a part of the society to get vaccinated. But with respect to the other methods we have available, we can also help them to be protected if they cannot be vaccinated successfully. Think about all the immunosuppressed ones. So masks and hygiene is still a major component, and in my opinion, will still remain a component in the future, but I also hope that we are leaving behind the masks next year at some stage.
Can I ask a point of clarification? So are you guys saying that if for a period of time in Germany, it was free to get tested?
Yes, absolutely. I mean, it is actually, as of now, it's still free. I think from tomorrow onwards, or I think October 25, the first deadline. For the students, it's until November 30, but that might depend also a little bit on the federal states. But yes, you are absolutely right. It has been completely paid by the federal state, and the same holds true in fact for the vaccinations.
Fascinating. That is not the case in the US.
I know. I mean, it is, what shall I say? I mean, you can also debate, the approach of Germany in this respect, because as you can imagine, people are getting more and more sort of spoiled with respect to their expectations, what the state has to care for. Yeah? Mm-hmm. So in the long run, I think it's good that we are now going back to a situation where at least part of the burden, financial burden, then has to be carried also by the society members. But for combating the pandemic, I think it was very good that we had these regulations.
Dr. Stevenson, would you like to elaborate from a US perspective on how this monetary incentive moving away from state financing towards out-of-pocket financing changes or incentivizes people to get vaccinated?
Well, in terms of the testing piece, there are some settings in which testing is free for someone. I think if you're a university student and your university requires it, then it will be free to you to get tested. But generally, and maybe in a healthcare setting, but outside of that, no. And certainly not the lateral flow assays that you can do at home. Those are very expensive. So, for example, I have a cold, right? So I went down to my pharmacy because I have some older relatives visiting, and I bought the home test, and it was $28 for me to do that test. And it's very hard to actually even find that test in most pharmacies. So this is challenging for us, and for everyone else in the general public, you usually did have to pay for your PCR test. So no one gets tested, right? Like if you have to pay that much, you do not get tested. So that's a problem number one. So people often go to work sick. And then they spread their virus all over the place. So this is there's so many elements of ways that we could improve things, just from simple things like having affordable testing. In terms of mandates and requiring testing, there are some areas where this is the case. So New York City has a lot of very strict rules that are, I think, actually pretty effective. And there's a lot of data to show that vaccine mandates are very effective, that in fact, if you put somebody's salary on the line, like they may lose their job if they're not vaccinated, they get over some of their reservations pretty quick. You do hear in the press a lot of times like, 5 people walked out of work, right? But then if you ask them the total number of people who work at that institution and they say, well, 3,000 people, and you're like, well, why did you report it that way? Actually, almost everyone got vaccinated because of the mandate. So the mandates are effective, I think. We just need to make sure that these things do not disproportionately affect very vulnerable populations and people who maybe have less access to medical care. So we just need to be mindful of that. But I do find that they are showing the mandates to be effective.
Thank you. And Dr. Bogdan, I just want to mention, I think it's going to be interesting now with a full class auditorium with masks, and I hope people get creative with the upcoming Halloween next week. I wanted to get back on the discrepancies that we quickly touched upon earlier from a global perspective, because we had some questions from the audience coming in that were interested in these inequities when it comes from an access point of view. And there are two questions in the chat. One is actually whether we will see further travel restrictions or if we see additional impact on the economy, on the mobility, because of these low rates in other parts of the world. Whether you think this is going to happen. And the second question is really on what do you think is needed to make sure that other areas in the world where healthcare workers or vulnerable populations haven't gotten or haven't been fully vaccinated yet, while we're discussing boosters, what needs to be done. Dr. Stevenson, would you like to take one or two of the questions?
Well, I think that we ignore global coverage at our peril. It's sort of insane, actually, to be talking about host immunity or endemic disease or what the future is going to hold while we let this virus replicate uncontrolled around the rest of the world. So first, there's a humanitarian issue and the ethical issue. It's horrible to see, healthcare workers dying at the rates that they are in many of these countries. It's shocking. So I think that's number one. It's the right thing to do to increase access to these vaccines, however we can do this. But then also there's our own selfish reasons why we should be doing this. So I think that right now we're actually kind of at a crossroads. We're talking here like we have this choice between living with no virus versus living with like an influenza-like scenario where older people get vaccinated and younger people get, the flu and stay home. We're forgetting like the third thing that could happen, which is that we have waves of progressively worse virus variants that actually completely evade immunity and are more transmissible and potentially more pathogenic. And this is not an impossible scenario because these viruses and variants are going to emerge. Like there's no doubt they're going to emerge in these other areas of the world. So we forget, like I said, at our peril, that we may be back to 2020 over and over and over if we do not drastically increase access to these vaccines worldwide.
Dr. Reinhardt, would you like to comment similarly on how you see it from a global distribution point of view, or if you want to address the question related to travel bans? Should we cancel flights or blacklist some of the, or not blacklist, but put countries on a higher risk profile and go back to quarantine rulings and others?
Actually, we do that still in Germany with certain countries. You have to be in quarantine coming home from certain countries with high risks. And I would say that we should not think so much about boosting the whole population of Germany or other rich countries, but we should look and provide to get vaccination in the poorer countries to increase vaccination rates in Africa or Middle America or in other regions of the world, and just to protect ourselves, because I think we will observe further or later some virus of variant of concern, and therefore it's only logical and useful to act in that way. And I think it's our duty to do that, because we can expect that Africa is able to logistically or it's not able to finance this effort. So I think we have to export the vaccination in other countries with lower incomes. It's a duty, and it's an ethical duty also, by my point of view.
Thank you. Dr. Bogdan, I know that you have some opinion on that as well, but I want to address another question as well and just chip it in. One of our questions from the audience is, what will the future vaccines look like? In the STIKO, the Standing Committee on Vaccinations, are you already looking at the next sort of second generation COVID vaccines that might address these issues that we currently have on the risk of variants, and how do you discuss and strategize on vaccination in 2022, or are you at the same time looking at the other ways as well, other preventative measures or medication that could complement each other?
The German National Vaccination Committee can only look at vaccines that are currently either under the authorization process of the European Medical Agency, or vaccines that have already been authorized. So the STIKO cannot, already make decisions on something that is still in the pipeline. Now, with respect to what is in the pipeline, of course, there is a certain degree of expectation with respect to so-called classical vaccines, such as peptide vaccines combined with an adjuvant, or also whole inactivated virus vaccines. That's something what the population is kind of familiar with, because at least those in Germany who know a little bit about vaccines, they sometimes even tend to argue, why don't we use the classical strategy? I mean, the emergency strategy, of course, was very quick with the mRNA, but now we can go back perhaps to the regular strategies. In this context, I would strongly argue that we as STIKO will certainly compare the efficacy and the safety of different vaccine approaches, which is our task. We have to really argue based on scientific evidence for safety and efficacy when we make our recommendations. So let's assume, a vaccine comes up, a peptide vaccine that is using a adjuvant similar to what we are using for protecting people against hepatitis B. Then this vaccine will be evaluated according to the criteria I just mentioned. And if it would turn out that this vaccine gives you, let's say, a stronger or even longer lasting protection, then it could end up in a situation that we have a categorization of different vaccines that are then recommended according to different purposes. Think about, for example, immunocompromised people who might use or might need a very, very strong stimulus in order to build up an own immune response. So I would argue, yes, this is certainly something that will happen. And I'm also convinced that even the current vaccines can still be, optimized with respect to a number of issues. Of course, they need to be adapted to the currently circulating virus. One might also think about dosage, think about comparison between the Moderna vaccine and the BioNTech vaccine. It is, I think, quite obvious that parts of the Moderna side effects might be related to the higher vaccine dose. So these are all aspects one has to take into consideration. And one key issue, of course, also is, can we, as a scientist, or can scientists also work on vaccines that really promote immunity in a longer range? So is it, for example, possible to think about a vaccine that gives you then protection against the virus for 5 to 10 years, as long as the virus doesn't change, which of course is kind of unlikely. But this is, I think, valid thinking, and it all depends on the scientific results that are going to be submitted by the responsible companies to the authorization agencies. And then the different committees for vaccination will have to evaluate these data. Yeah.
Thank you so much. Time flies, and we have 5 minutes left. Dr. Stevenson, would you convey us some last messages, maybe a bit of your outlook into the blurry 2022? What kind of milestones do we need to hit? What kind of efforts do we have to step up in order to advance on this pandemic or acute pandemic endgame in the US?
Well, number one, I believe in science, obviously. I'm a vaccine developer, so I could spend the next hour kind of jumping off of what Dr. Bogdan was talking about and really get into all the really exciting ideas that are in the vaccine pipeline to address variants and increasing the durability of immunity, because I do think there's a lot of wonderful ideas there. So number one, I think that science is still working hard. We're working really hard. And I have a lot of high hopes about making even better vaccines. But I do think the main points that I would say with what we have right now is that we have got to increase access to these vaccines around the world, number one, number two, number three, all of it. We can work and tinker on the boosters, and we can tinker on, adding sequential immunization, or even adding, non-pharmaceutical interventions. But until we get increased access to these vaccines worldwide, we are not going to get control of this virus anytime soon.
Thank you, Dr. Stevenson. Dr. Reinhardt, any thoughts from a German point of view, from German medical associations? What are you hoping for in 2022 that our path will bring us through?
Yes, I can observe a lot of polarization between the society, and I hope that we learn to deal the things with the point of view of the scientists, a rational thinking point of view, and that's very important. I hope that this lesson is learned now by the discussion we have had since 18 months now, and this, I think this is also a very big and important point to learn that, and so let's hope that we get away or get ahead in that way, and that we will have a critical and a rational but effect-based discussion in the next months. And so I hope that we can control the pandemic better than now, even better than now, and that we can become back to a new normal or a lightly different normal in the next months.
I hope that one of the repercussions of this whole pandemic was that people actually trust and listen more to the scientists, and we might have some positive side effect when we want to tackle climate change and go into some of the other discussions which are much broader for our society. Dr. Bogdan, I would like to ask you similarly. What do you wish for in 2022? Where do you see some of the next steps we have to take in order to reach either the herd immunity or the herd protection that we talked about, and go back to our new normal?
I would argue that there are a number of main lessons that we hopefully have learned from the pandemic as far as it has been running. So lesson number one is, in my opinion, that large parts, at least of our society, has realized that hygiene is a very effective preventive measurement. And many people actually experienced and then talked to me about this, that they haven't had a cold now for more than 2 years, based on all the hygiene measurements. Now you could argue, is that an ideal world we should look for? And I would say, of course not. It's a big misunderstanding that prevention of any kind of infection would be beneficial for mankind. If you consider not only the evolution of the immune system, but if you also consider that immunity or the immune system is not just defending microbial pathogens, but it's also, for example, important to prevent allergic reactions, or it should be sort of modulated to prevent allergic reaction. The immune system is also necessary to combat tumors. And from my personal perspective, I think if we would reach a situation that the vast majority of the world population has acquired a basic immunity against SARS-CoV-2, hopefully by vaccination and not by severe disease, then we can build on that. And then we can also allow people going back to a normal lifestyle. Because if you have acquired basic immunity against this virus, and we have learned similar lessons actually also by the influenza virus, despite the fact that influenza virus is massively changing all the time. But a certain degree of basic immunity will allow you to go back to normal life. And it could also allow you to then become naturally boosted by exposure to the virus again. I think my personal hope is that the vast majority of our societies will really receive the vaccinations, acquire basic immunity, and therefore will be protected from severe disease. I also hope, as a second point, that some of the hygiene lessons we have learned in general will be maintained. So, for example, the effect of simple hand washing. This hasn't been clear to people that soap can be absolutely helpful against enveloped viruses. And a third point, which I also hope that will make it into the future, people have learned that science and scientists have a function in our societies. And despite all the battles, or sometimes even between scientists, but also between scientists and politicians, my personal conviction is, I'm personally convinced that in the end, this particular pandemic will leave at least some trace marks in the brains of all of us, that science is really ideally suited to give us back the chances for a better life.
Dr. Bogdan, Dr. Reinhardt, Dr. Stevenson, thank you so much for this wonderful discussion, your insightful contributions. And with this, I'll hand it over to Jeremy Martinez.
Good afternoon. So my name is Jeremy Martinez, as Letizia mentioned earlier, and I'm one of this year's organizers for the German American Conference. So I think that we've seen that despite constant efforts by brilliant minds the whole world over, COVID-19 unfortunately continues to present us with difficult challenges, even now 2 years later. Still, I think much progress has been made, and I remain optimistic that we'll succeed in finding our new normal. So with that, I just wanted to take this moment to thank our wonderful speakers, as well as our moderator, for this interesting and very timely discussion. Special thanks as well, of course, to you, our audience members, for your attention and active engagement in the Q&A. So this is the end of this event. However, it is not the end of the German American Conference. Please join us for our next event at 1:30 p.m. Eastern Standard Time, during which we'll discuss the ever-evolving relationship between the EU and China. Thank you, everyone.